Well, thank you for joining us today. My name is Tim Safley. I'm the Director of DMEPOS Pharmacy and Sleep at the Accreditation Commission for Healthcare. Our topic today is going to be about achieving and maintaining sleep accreditation. For those of you all who are not familiar with ACHC, we are we're an accreditation company that actually accredits companies for many different programs. As you can see by this map, we have over 11,000 accredited locations throughout the U.S. This is not just sleep locations, it's home health, medical equipment, pharmacy, and we have deeming authority from CMS as well as most insurance providers. When we talk about accreditation, a lot of people start getting really nervous. I want to go with the acronym of KISS. Everybody's heard of it before. It's Keep It Super Simple. Accreditation is no more than what you do on an everyday basis. Every one of us in the sleep business has been around for many years, has done this for many years, and is very familiar with exactly what goes on in the sleep world. And when you have somebody come to your lab, you're going to treat them right. You're going to treat them correctly. That's why they come to you. Well, a lot of times what we find in accreditation is that everybody does these processes, but they don't document it. And that's kind of the key. You need to make sure you're documenting all the activities that you're doing between the customer, between the physician, and between the lab itself. As we go through this general accreditation, again, we want to keep it very simple and focus on exactly what your organization does. Know what you want to get out of accreditation. CMS compliance or Blue Cross Blue Shield, Aetna, payer groups such as SBMs, I will use that acronym throughout today. SBMs is specialty benefit managers such as AIM Network, CoreCentric. They're out there and they mandate that a company that's going to be doing that wants to be reimbursed goes through an accredited lab. You want to make sure that you pick a place to store the data, make it easy to review, make sure everybody, every employee knows where this organization and where this data is stored. You know, one of the hardest things as being an ex-employee and also an ex-owner of many different healthcare entities, you want to pick a time each month to review the data. Know what data you're going to review. And I say that because that's one of the first things that seems to get put to the side. I'm too busy, I don't have time to review this data. You have to make time to review the data, and if you do that and get in a part of doing it every single month, you're going to find your business runs much better. You want to develop a plan to address any identified negative trends. You know, one of the things that we do is we collect data, and a lot of times if we score 100%, I go into an organization, oh, we're doing this, and we always are scoring 100%. Well, chances are you're probably doing that well. Want to look at something you're not doing well. Maybe you're not cleaning equipment well. Maybe you come in and see the equipment that's there has a stain on it that you didn't clean out. Maybe you're finding you're missing a physician documentation of one study. You won't, obviously these affect the way your lab does. It affects the way you get your reports back to the physicians, but more importantly, it affects the way your day-to-day operations. So you want to document every activity that you do. So why bother with accreditation? Why is it there? On February the 2nd, 2009, the Oklahoma Sleep Diagnostics Testing Regulation came into effect in Oklahoma. This was many years ago, and you can read this slide yourself exactly what it means, but what we found more and more of is that not only is it regulatory issues from payer sources such as Medicare, Blue Cross Blue Shield, Aetna, SBMs, but also states now have gotten involved in who can do sleep, what's going on with sleep, who can read these studies. So this was just one legislation that came about, and this is one right after we first opened, ACHC started accrediting sleep labs. They actually included us, who as the Academy of Sleep, and the Joint Commission. CMS, I get a lot of questions about CMS. So this is Medicare and exactly who sets these regulations. It's kind of interesting with CMS because they have left it to the local providers and contractors to decide if accreditation is mandated. You have two types of coverage. You have an NCD, which is called National Coverage Determination, and you have an LCD, which is called Local Coverage Determination. So I want to make sure that everybody understands what these different differences are, because it really does know where to go for the resources to find out what is required by your local Medicare coverage. A national coverage determination called NCD sets forth the extent to which Medicare will cover specific services, procedures, or technologies on a national basis. Medicare contractors are required to follow the NCD. So if an NCD is set and the government says this is the way we're going to do it, every contractor that deals with Medicare has to follow it. If an NCD does not specifically exclude or limit an indicator or circumstance, or if the item or service is not mentioned at all, then an NCD or in a Medicare manual, it is up to the Medicare contractor to make that coverage determination. Interesting, in sleep, most all standards set forth for the sleep world are controlled by LCDs. And LCDs are local coverage determination or policies developed and published by a Medicare administrative contractor, carrier, or fiscal intermediary. An LCD cannot contradict an NCD, but it can expand on a specify the limitations of coverage. So an NCD can say you have to be accredited. An LCD can say who these accreditors are, what needs to be looked at. So they can actually strengthen an NCD requirement. Let's take a look at what Medicare does now. As of 3/12/2012, these were all the different LCDs that covered the business of sleep. And this is not the DME business of sleep. This is really the sleep labs, the IDTFs that are out there today, or the physician-based facilities. And however, of 2012, and they're still implementing it, the LCDs changed. Now, these are the consolidated A and B jurisdictions, consolidated Medicare Part A, Medicare Part B, of what coverage area you're in. As we talk about this, interesting, so my business, I'm out of Raleigh, North Carolina, although we do national. The LCD changed. Not only did it change the region that was covered, and you can see now that's North Carolina, South Carolina, Virginia, and West Virginia. It also excluded several of before accredited preferred providers, meaning that the LCD, when it changed, it only accepted AASM and ACHC as an accreditor of choice. So when you start choosing for your right accreditor, you need to make sure you do the research, or call ACHC who can help you in that. Do the research. Are you accepted in these regions? And again, it's not just for Medicare, because Medicare could say one thing, Blue Cross Blue Shield could say another. Your SBM, Specialty Benefit Management Team, can say another one. Okay, so as we start going through accreditation, the one thing that I cannot stress more is all about maintaining compliance. Maintaining compliance, you also have to do it. You also can save you money. It's also based on what they call FWA, fraud, waste, and abuse. A lot of people are not sure what these definitions mean. So let's kind of go through exactly what fraud is. Fraud is an intentional deception or misrepresentation that the individual knows or company knows to be false and makes knowing that the deception could benefit the individual. Waste is unintentional misuse of Medicare funds through inadvertent error, most frequently incorrect coding and billing. In our industry today, not on the DME side, but on the sleep lab side, as well as the DME side, there are very limited codes that you bill for. So we don't see waste too much in the sleep industry. We do see abuse, though. Incidents or practices of providers or suppliers of service that are inconsistent with acceptable sound medical practices, directly or indirectly resulting in unnecessary costs to the Medicare program and Medicaid program. One of the things I would mention is that there was a sleep facility out in the Texas, New Mexico area that ended up having to pay back well over $3 or $4 million to Medicare because they had improper use of people that were doing the studies. That being said, they did settle out of court for a different one, and so whether it was fraud, waste, or abuse, it was never determined, but they did settle. So make sure that when you do these studies for Medicare or Blue Cross, you're following all the standards that are required there. And by doing that, it can save you a lot of money when you do audits. When audits are done, or when they try to recoup money, such as Medicare does. The purpose of accreditation is very simple. Accreditation is a CMS and private payer requirement. Since you have no choice, let's add some value to it. One of the things we designed with our accreditation program here at ACHC is to make sure not only are we giving you the accreditation needed so you can get the reimbursement, we also tried to devise a program, and really did devise a program, that can access and can benefit you as day-to-day business owners. Accreditation enables the organization to assess processes of care, services, and operations. It also does an organizational-wide performance improvement efforts, and sometimes the performance improvement is also called quality improvement. It can vary for terms. Don't confuse this with a compliance program. And I'll take a minute to just make sure everybody understands the definition. Performance improvement is how your ongoing monitoring activities of what you do in the day-to-day. Compliance program is how you making sure that a company is meeting, and I want to stress that, is meeting the regulations set forth by state, federal, and private payer requirements. So in what we do with these performance improvements, we improve quality by monitoring care and services, client and patient safety, operational efficiencies, and regulatory compliance. PI can help you find issues before they turn into problems that could lead to patient issues, payment refunds, and quite frankly, put everything in danger because you're not getting accurate data for the physician and yourself to interpret. Why are the accreditation standards important? If you don't hear anything else today, this is one of the most important things. If you play in the world of Medicare, and I say play in the world of Medicare, if you have a Medicare provider number and bill Medicare, there are key elements of a compliance program from the OIG that you must have. This is important for our accreditation because if you're accredited by ACHC, we cover every one of these standards. So 1 is policy and procedures, code of conduct. 2 is designation of a compliance officer. I cannot stress this enough. One of the things we see on sleep surveys is we walk in and start talking to the staff and we say, who's your compliance officer? And they don't know. If you play in the world of Medicare, it's not saying a person can't have a dual role, but it's very important to understand who the compliance officer is. You need to have open communication and organizational chart, education and training of the people delivering the services contracted, internal auditing and monitoring procedures, investigation of detected problems, and enforcement of sanctions. I put this up there. It's so important to understand this, but it's also important to know as you pick an accreditor to make sure the accreditor covers every one of these in their standards. And with our standards, when you take a look at them, you're going to notice these are covered, but they're covered with day-to-day operations that you're already doing. We do not want to complicate what you do on a day-to-day basis for accreditation. Accreditation organizations that are out there for sleep: Accreditation Commission for Healthcare, the American Academy of Sleep Medicine, the Joint Commission, and the compliance team. These all have sleep programs out there for accreditation. However, make sure you do research to make sure some of them are approved before you go to it. It's not always about cost. And when you do this for an accrediting organization, you need to look at costs for the whole time period that you are accredited and how the accreditation works to you. We'll talk a little bit more about this in a minute. One of the things you need to look at is how to choose the right accreditor. The following are suggestions for providers to consider when comparing accreditation organizations. I'm saying this, although I want ACHC to be your choice, you certainly need to take a look because certainly ACHC may not meet your needs. So as you go through this, when you choose your accreditor, go through these simple questions. Review the accreditation application and standards. Please take a look at the standards so you know exactly what's going to be expected of you when we show up there on site. You also need to compare the total cost of accreditation. This is one of the most important things. ACHC offers a 3-year accreditation as well as the Joint Commission and the compliance team. AASM offers a 5-year accreditation. With these accreditations, though, there's also there could be yearly cost added to it. Membership organizations charge to be a membership. So you need to look at that total time period of a 3-year cycle of exactly what's cost. The other thing you need to do on this is, is the survey cost including the travel expenses of a survey? When we give a cost of accreditation, everything's included in that cost, especially the surveyor expenses. One of the things as you started budgeting, one of the things we learned way back is as you budget the time, you want to know exactly what the cost is. That's why we give you one flat rate, and you don't have to worry about what the travel expenses are if the inspector came from a further off location. You want to identify the professional support provided by the AO. Can you call? Can you get in touch with them? Is there an accreditation advisor? Is there one person assigned to your account? One of the things we do here at ACHC is to have a kind of internal thing of you need your call back from your accreditation support in about 4 hours. Do we always meet this? No, we don't, but we certainly strive to do that. And that advisor that we assign to your account can certainly get back with you within that time frame or a point of that time frame, so they can help you out, answer your questions. You also need to examine the performance improvement requirements. What are these requirements you need to do? What are the ongoing activities? You also want to evaluate the process for submitting the application. Is it a hard process? Is it an easy process? Is it online? Do they accept the application? About ACHC, we are a nationally recognized accreditation organization with 27 years of experience. We do have deeming authority, meaning that CMS accepts us as their eyes and ears outside their organization, so they don't have to come out and do their own inspections. And we have this for home health, hospice, and DMEPOS. There isn't one for sleep right now. That's all controlled, as we talked earlier, by the LCDs, not the NCDs. But we are deemed for DMEPOS. We're also recognized by private payers for DMEPOS. Therefore, if your lab does such things as dental appliances or CPAP machines, oxygen related to that, you could bill Medicare if you met the Medicare criteria. We are recognized by most major third-party payers. We are the first accrediting organization with a quality management system and certified by ISO. So not only do we ask you to go through the accreditation process, we go through ISO to be certified by ISO so that we're meeting certain accreditation standards too. And this is done on a yearly basis. ACHC sleep accreditation is very patient-focused sleep accreditation. We're actually looking at standards that are built from the patient up to the documentation of what you need, up to the management. Our realistic accreditation standards are developed with input from industry professionals to ensure relevancy. This includes the therapists, the registered polysoms, and the sleep physicians that actually help build our standards. That's why you can see on our logo about ACHC, we are for providers by providers. That is who helped design the specific standards for you. Our service-specified standards for sleep lab accreditation and home sleep testing. So we have two separate programs. However, please be aware that if you go through our sleep lab standards, which are called our SLC accreditation, it includes our HST, so you don't need to go through any additional requirements. So in other words, if you are accredited for your sleep lab and you do home sleep testing as part of that, that is part of that cost, and that is part of the sleep lab accreditation. Home sleep testing, as we know, I just put this up there because way back United Healthcare, as you all know now, United Healthcare, Blue Cross Blue Shield, some of the SBMs, they're all requiring home sleep testing to be done before you have an in-lab test. What we've seen is a total embracing, or most of a total embracing, of sleep labs to start taking out and doing home sleep testings within their labs. Accreditation standards are created for providers by providers. What differentiates us? Why would you choose ACHC? Well, first off, we have the reputation for providing industry-relevant standards. We don't provide standards that don't have anything to do with sleep. One of the accreditors that we've mentioned before really did the basics. So if you go through sleep accreditation or you go through an independent lab that does blood testing, they put you in the same category. Our standards are written by sleep professionals for sleep. The standards are centered on the service recipient and applicable to the type of services and care being provided. We have clear, concise language and helpful interpretations for implementing and maintaining compliance. What differentiates us with our sleep standards too? ACHC requires that the medical director is an active medical director who understands the operation of a sleep facility. It requires that all testing be reviewed by a physician who is board-certified sleep specialist, but does not require a specific number of hours per month that he needs to be in a specific lab. So as long as you have a board-certified physician reading the studies. One of the other questions that I get asked a long time is, does the medical director have to be a board-certified sleep physician? Originally, our standards were set forth that way, but we modified that because we found a lot of rural labs and rural hospitals didn't have the availability of a board-certified sleep physician. Their medical director, we do require a medical director. So they don't have to be a board-certified physician. However, a board-certified sleep specialist must be involved in the interpretation of the sleep studies. ACHC standards do not require patients to be referred to a sleep facility by a member of any specific organization. So if a person needs a sleep study that is recommended by their general practitioner, their family physician, or even another specialist such as an endocrinologist or cardiologist, then they don't have to be any members of any specific organization. We say your lab can certainly do those studies. We also, ACHC does not specify the size of the sleep facility. If you're meeting state and federal and local requirements for the handicapped or whatever you need, then we don't specify what's your lab and the size of that sleep facility. What I'd like to do now is take a few minutes just going through our standards chapters. So our chapters are set up in 7 different sections. The first one is based on organization and administration. This section really applies to the leadership and the organizational structure of a company. They talk about licensure, and it really addresses the day-to-day operations in any business of what you do in a business. Section 2 are the program and services. So if you just do in-lab sleep studies, then this section 2 would describe what you do. It also addresses the rights and responsibilities, complaints, protection, health information, diversity, and compliance with fraud and abuse. This is the section that actually you need to take some time with to make sure you're meeting all the requirements out there to run your business. The third section is fiscal management. This is a very small section in our standards, but it does make sure you have appropriate funds to support the activities that you do. Human resources. This section really talks about how your personnel are trained, how your medical director is trained. Is he board certified? Is he not board certified? Do you have a contract with your board certified group that is actually reading these sleep studies? It talks about, is your staff trained? Do they have the appropriate, if your policy says I need them to be CPR certified, are they CPR certified? We looked at their training. We looked at their ongoing CEUs, ongoing education. So that's just the human resources. Are people trained to do what they're delivering? Number 5 is provision of care and record management. How are you delivering the care that's done? How you're delivering the sleep study, and also the record management. Section 6 is the quality outcomes. This is probably our smallest section besides our fiscal, but the one that gives the most trouble to our people, to our customers. So you need to make sure that you're looking at the performance improvement plan. Take a look at this chapter, and if there are things you don't understand exactly what to do, because this is a lot foreign to a lot of people, then that's when you need to call ACHC and your accreditation advisor to help you understand this a little bit better. Section 7 is risk management. This talks about infection and safety control. Things like, are you cleaning your mask? Are you recycling your mask? Are you calibrating your machines? This is all outlined in the accreditation standards to make sure you are meeting the regulations of local and state government. Okay, let's talk about getting started. So we're on the final steps here of how do you get started to become an accredited lab of ACHC. First thing you need to do is download your program-specific standards, accreditation standards. So when you go into our website, log in, you can pick the standards you need. So do you need sleep lab? Do you need sleep lab and home sleep testing? Do you need sleep lab and DME? You can actually do this and pick the services that you'll delivered. And if you're unsure about this, you can always call our office and someone there can assist you in how to figure out exactly what needs to be done. Step 2 is complete your application and submit your deposit. We do require a $1,500 deposit to process your application. Number 3 is submit agreement, payment, and preliminary evidence report. We'll talk about this in a little bit more about what's included with the preliminary evidence report. But the agreement is going to make sure it's agreement that we will survey you, and it's agreement that you will be ready for the survey when we show up. I will tell you one of the things that we get asked a lot is that how soon can you be out there? Well, once you're ready to apply and you have the policy and procedures, normally the time frame is anywhere between 30 to 60, rarely over 90 days. This is a scheduled on-site visit to your location that's scheduled between your surveyor and yourself so you know when we're coming. So step 5 is ACHC sends your survey results and your accreditation decision. Normally after your survey date, your accreditation decision comes to you within a 2-week time frame. Let's take a look at step 1. If you go to achc.org, this is how you download your standards. Once you sign in, you can download your standards by actually filling out this information. It asks you what you want and what's going on, and everything is done online. If you ever have trouble with this survey, you can see we have a video that's a part of it. But if you ever have trouble filling out the application, please give our office a call and we can help you walk through it. Then you download your standards. As you can see in this video, you can have 2 choices, or this PowerPoint, you have 2 choices. One is you have SLC, which is your sleep lab center services, or you have your HST, which is home sleep testing. Again, if you have a sleep lab that is also doing HST, you only need to assign SLC because it includes both. You have your online application. Your online application you fill out, and this actually gives you, are there partnerships, are there more than one branches, what's going in the main office. This is when we determine exactly the price of your survey, the locations, how many days will be needed. Then a deposit. A deposit all the time is $1,500. This includes, and by the way, this is not a deposit in addition to your overall survey fee. This is a deposit that is applied to your total survey cost. The last one is an agreement. An agreement will be sent to you that is an agreement between us and you, knowing it's actually aligning out what the duties are of what we are obligated to and what you as the organization are obligated to. Once that is done, then you have to submit back to us a preliminary evidence report. As you can see in this, we don't ask for all of your policy and procedures. There are certain things that we ask for that we want to review before we come on site. As you can tell, and I want to point out, everything else in this will be reviewed on site. So to go through this real quick, it's an accreditation application, a non-refundable deposit, and then we give to you an organization must submit several of policies on compliance plan, and we actually outline the exact standards that are needed that you would need to send in so we can review. You would need to provide to us an organizational chart by position titles. You don't have to put individual names. We understand they change. So just the organizational chart will work. You want to provide your organization's performance improvement plan, how you've done it. Now we do have, if you've never come to us before or you're a new company, that's either that you've been accredited by somebody else or you're brand new for the industry, you might not have a whole PI plan that you've ever done. So a general outline of how you're going to get this together, what you're going to do in the future, is all we would request from this one. A lot of times the surveyor on site can help educate you exactly what will be expected in the future for your PI program. And then you're going to provide, either by policy or outline, the amount that the medical director is involved in the open sleep facility. So those are pretty important things you have to do, and then you'll sign that you attest that you have all policy and procedures. ACHC survey are conducted in a consultative manner by experienced licensed sleep professional with a minimum of 10 years of sleep lab experience. ACHC survey consists of 2 stages. The surveyor conducts interviews with a medical team at the sleep facility to learn about the operation, reviews the company's quality improvement plan, personnel training records, client records, etc. That is usually done in the morning or in the afternoon of the night of the sleep lab of an individual going through sleep study. Then the surveyor will do all that. They'll probably go back out to dinner or something, get something to eat, take a little break. Then they'll come back to visit the sleep facility in order to observe the actual service provided, which includes the patient education, the interaction between the clinician and the patient, and the actual sleep testing. We certainly will not stay there all night. We certainly will be there, though, until the patient either falls asleep or their education is done. The survey will be scheduled once your assigned accreditation advisor receives all the necessary information. The time frame for completion can vary, but the announced on-site survey is usually scheduled within 60 days from the receipt of all information. Your assigned accreditation advisor will coordinate with you to ensure that a patient is scheduled during the on-site survey. Now, we do know that if you have a 2-bed lab or 3-bed lab, sometimes the patient does call in sick or doesn't show up. We understand that, and we will adjust this, but normally we always like to see a patient in the treatment of the patient and the hookup of the patient before we grant accreditation. Okay, we have a quick video that I'd like to share with you, less than a minute, and we'll discuss it a little bit right at the end.
Sleep. It's a natural, periodic state of rest for the mind and body. It refreshes us like nothing else. It can be occasionally elusive, almost always comforting, and definitely essential to our health and well-being. And although 33% of our lives are spent asleep, we barely give it a moment's notice until we can't get to sleep. There is a growing population of individuals who may suffer from some type of sleep disorder but are unaware or have not been tested. Someone who always feels tired and never really seems rested should seek out a healthcare professional that can refer an accredited sleep facility for proper diagnosis and care. As the number of sleep disorders increase throughout the United States, ACHC continues to educate consumers on the importance of sleep while holding sleep professionals to the highest standard of care. For more information, please visit achc.org.
We put together this video along with a longer one of a 6-minute video that actually went through for a public service announcement to talk a little bit about the sleep industry, where it's going today. You can see ACHC in here. We actually was produced by Healthline that put it out. We have this one's a minute. We have another one that's a little bit longer that's 6 minutes. It's actually out on YouTube that talks about the sleep industry. We realize with so many sleep disorders that are out there today, we wanted to make sure that the individuals got treated and moved on to the healthcare professional. So one of the things I'd like to end up today to is tell you, you know what, you know when we're coming, but at this point you need to keep a regulatory book. And I always say this, everybody that's working in that location needs to know exactly where this book is. These are all documentations required by CMS or your providers, such as Blue Cross Blue Shield, or an organizational chart, emergency phone numbers, and a locational listing where all documents may be found, such as complaint logs and training records. Training records might be in the personnel file. Most people don't keep them there. They keep their own log. That's certainly up to you. Same thing with complaints. A lot of people keep complaints in a complaint log. I would recommend this is the way they do it instead of putting them in individual a patient's complaint. But that's certainly up to you, and it's certainly a choice. I want to thank you for calling in today for this presentation. I'll be available for questions right after this. This is my contact information, and we really appreciate your time today. Thank you.